Welcome back to Anatomy and Physiology on Catalyst University. My name is Kevin Tokoff. Please make sure to like this video and subscribe to my channel for future videos and notifications. In this video, we're going to finish up our study of Lab Exercise 2. We already discussed body cavities and serous membranes, so we looked at parietal layers and visceral layers. And now we're going to look at the specific organs inside the major cavities, that is the thoracic and abdominal pelvic cavities. And then we're going to go and look at different ways in which the abdominal pelvic cavity is divided up, and that is in quadrants and then also regions, okay, of which there are 9. So let's talk about the various organs, and we're going to just look at the basic ones that you might see in the beginning of Anatomy and Physiology 1. So let's talk about the thoracic organs and the diaphragm. So really for this lab, you need to be able to locate these organs in the thoracic cavity. These are thoracic organs, and there are 4 of them. First of all, we have the trachea, we have the esophagus, the left and right lungs, and the heart. Now, most likely by this point, you can identify lungs and the heart. Those are things we kind of already have an idea of. Here's the heart right here. Remember, the heart is technically in the pericardial cavity. And then we have the lungs lateral to the heart. The lungs are each contained in their respective pleural cavity. Now, just remember, the lungs have a left and a right because there's 2 of them. The left lung is on this side because it's the patient's left. And over here we have the right lung because it's the patient's right. Now, the trachea and the esophagus. These 2 are often confused with one another. This structure right here, I'm going to zoom in. This is the trachea. Okay? The trachea is part of the respiratory system. Okay? It's part of breathing. And the way to identify the trachea versus the esophagus, the trachea is anterior. It's in the front. The esophagus is actually behind the trachea. So if you're just looking at it like this, you won't be able to see the esophagus. Also, the trachea has these ringed structures going around its circumference. So here's a ring right there, there's a ring, there's a ring, there's a ring. It looks like we have 5 rings visible. These are actually cartilaginous rings, or they're rings made out of cartilage. They help keep the trachea open. Okay, so this is your trachea. It's anterior. If you were to remove the trachea, which some models will allow you to do, you would be able to see the esophagus behind it. Okay, so the esophagus here is not visible. The esophagus, in contrast, is part of the digestive system. And actually, we can use some directional terms to describe these. Again, the trachea is anterior, or we could say ventral, whereas the esophagus is, relative to the 2, posterior and dorsal. Okay, so hopefully that makes sense. Now, as we mentioned in the previous video, the diaphragm separates the thoracic cavity up here from the abdominal pelvic cavity down here. This right here is the diaphragm. Now, a couple of things about the diaphragm. First of all, if you look it up, you'll probably see it referred to as the thoracic diaphragm. Okay? There's a lot of diaphragms that you can have. This one is specifically the thoracic diaphragm because it's involved in breathing, and breathing is associated with the thoracic cavity. All right. The second thing is notice its spelling. This is one of those words that's typically misspelled by students. Make sure you get the spelling right. It's not spelled as it's pronounced. You have D-I-P-H-R-A, and don't forget this G, which I have underlined, M. So it's diaphragm. Now, if you're looking at the diaphragm here, it's pretty easy to see. However, if you're looking at the cat cadaver, it's a little bit more difficult because the diaphragm actually is the same color basically as the liver, which is actually going to be right below it, kind of in this area right here. So the diaphragm is a muscle, okay? And actually when you look at the diaphragm in the cadaver, it's actually best to kind of look at it from the top. Okay, and you'll be able to see it better that way. If you look at it from the bottom, you'll actually be seeing the liver most likely. Okay, so make sure that you're able to distinguish between the diaphragm and the liver. Again, with the diaphragm, you're probably going to want to view it from the top, okay, from up here. If you're looking at the liver, you want to view it from the bottom. And we're actually going to cover the liver on the next slide. But I want to make sure you understand that the diaphragm is a breathing muscle and that the important thing here is that it separates the thoracic cavity from the abdominal pelvic cavity. Now, in contrast to the thoracic cavity, the abdominal pelvic cavity has a lot more organs to it. Okay? And some of these, in fact, cecum, actually, we're going to throw out. This one we actually don't need to know for this course. But all the others we do. Now, let's start at the beginning and talk about where these organs are. So the first is the liver. The liver is right here. What you should notice about the liver is that it has a part over here that's not very tall or thick, but on this side, which is the patient's right side, it's a lot taller or thicker. So the thicker part of the liver, as we might say, is on the patient's right side. All right. Now, the spleen. The way I always teach this is the spleen is always on the opposite side as the liver. That is the thicker part of the liver. So the thicker part of the liver is on the right side. The spleen is on the patient's left side. And you may actually, on a cadaver, have to sort of lift up the stomach right here, which is actually number 3. You may have to lift up the stomach to see the spleen, because the spleen can kind of fall behind the stomach. Now, the fourth thing here is the pancreas. The pancreas is going to be in most models ileocecal valve. Okay? That's where the ileum of the small intestine fuses with the large intestine. So with the small intestine, you have 3 segments in order there: duodenum, jejunum, and ileum. Now we have the large intestine, which is also called the colon. Right? So the first initial part of the colon moves upward, so we call it the ascending colon. Then it moves towards the patient's left, and so we call this part the transverse colon because it's moving in a horizontal direction, transversely. And then food moves downward, and so we call this part the descending colon. Technically, it has a 4th segment over here called the sigmoid colon, but again, that's something we'll learn much later in A&P 2. For the purpose of this course, you need to know that this is the small intestine, it's interior, and then the exterior intestine is the large intestine or the colon. All right, now I'll just mention this, that the initial part of the ascending colon, kind of down here, is called the cecum. Okay? If you look at the cecum, you'll see this little tail whip-like thing that's sticking down here. This is actually called the appendix. If you were ever wondering where the appendix is, if somebody has an appendicitis, they get the appendix removed. This is the appendix. It actually hangs down from the very base of the ascending colon, which is called the cecum. Right? Now, the kidneys. The kidneys are not visible in this picture, and they're really not visible very well in any picture because all these other organs sort of cover them up. Again, kidneys not visible here. In order to understand where the kidneys are, we need to understand that they are the most posterior of really any of the organs in the abdominal pelvic cavity. All right. So there's a left and right kidney, and they lie very close to the back. Right. So to help you with the boxers, one of the important rules is no kidney punches. A kidney punch is when your opponent is turned away from you, which sometimes happens if they get knocked, and you take your glove and you just punch directly into their backside at the level of the kidney. The reason this is so dangerous, and it's called a kidney punch, is because that blow can transfer some force into the kidney and cause the kidney to rupture, which can be fatal. And the only reason that you can cause that much damage to the kidney is it's so close to the backside. And so the kidneys are going to lie pretty much behind all of this, right? But there's a left and a right one. Again, the left is going to be on this side, right's going to be over here. Now, the 11th thing in this list is the urinary bladder. The urinary bladder is not visible here, but I'm going to switch to a different view. We'll actually look at this. This is technically for the quadrants, but we can see the urinary bladder actually down here. What you'll notice is that it's in the pelvic cavity, okay, specifically. So it's at the very bottom here, and typically in most of these models like this, you're actually going to have to physically take out all this stuff right here, all of the intestines. When you take those out, you'll actually see the bladder underneath there. And really, for full credit on this, you'll need to write urinary bladder. All right. Most of these organs, so 1 through 11, you've probably heard of them. There might be a couple of exceptions, but you've probably heard of them, are the greater omentum and the mesentery. These are a lot less commonly talked about, and they're a little bit difficult to understand. So what I'm going to do is I'm going to take some separate slides to discuss the greater omentum and the mesentery. First, we're going to talk about the greater omentum. What is it? So the greater omentum is a fatty layer of tissue that hangs down from the stomach and covers the abdominal pelvic organs. So normally when you look at most models, you actually see something like this. You actually can physically see the small intestines and the large intestines. Over here is what we actually have in real life. If you actually were to take off your flesh, which don't do it, obviously, but you would actually see this greater omentum covering all of the intestines. And what it is it's part of the immune system, but it also provides physical protection. So this is our greater omentum. Notice that it actually physically hangs down from the stomach and it covers all this stuff. Here's another view of it right here. On the patient's right side over here, the greater omentum has been removed. Over on this half on the patient's left side, we still have the greater omentum. And notice that it does hang down from the stomach, which is actually right here, and it covers all of this stuff. And so in addition to being part of the immune system, it provides physical protection. Okay, that is the greater omentum. And the thing to understand about this to differentiate it from mesentery is the greater omentum is anterior or ventral. It's on top of all of these intestines, both small and large. The mesentery is a little bit different, right? So the mesentery isn't visible here because the mesentery is technically between all the tubes of the small intestine, okay? And there's other pieces as well. But if you were to kind of look at these little cracks right here between the tubing of the small intestine, the mesentery would be between them. So what I want you to imagine is take this tube right here and this tube that's adjacent to it and pull those tubes apart. And you'd get something like this. Notice this person who's doing the dissection, you've got the tube right here. They've actually physically pulled it away from this tube over here. And what you actually see is this web-like structure. I like to think of it kind of like the webbing in duck's feet or something like that. So you see this webbing, right? In fact, it's sort of translucent. You can almost see through it if you shine light on it. This is mesentery, all this webbing. The mesentery does not lie on top of all this. It's really just between the various tubing of the intestines, and you actually have to pull them apart to really see it. Okay? So it's a contiguous set of web-like tissues that anchor the intestines all to each other, but also to the posterior abdominal wall. Okay? And with the mesentery, you can really only see it on the cat cadavers. The greater omentum you can see on the cadavers and on some of these models. So either one could be asked in terms of the greater omentum. For the mesentery, it has to be on the cadaver, right? And in addition to providing some structure, it also contains fat, blood vessels, and lymphatics and nerves. These little things right here that are kind of yellowish and red, these are actually going to be nerves and blood vessels that are actually going to various portions of the small intestine. Okay? So hopefully that makes sense. So make sure you can understand and identify the greater omentum and the mesentery for any quiz or exam. Now, I mentioned we'd talk briefly about ways to divide up the abdominal pelvic cavity. Okay, so we're not dividing up the thoracic cavity, but we're going to divide up the abdominal pelvic cavity into quadrants or regions. Now for quadrants, there are 4 of them. Quad means 4, so there's going to be 4 quadrants. Okay, and they're pretty easy. We have left and right and upper and lower. So this one right here where my mouse is, this is the left upper quadrant. It is also technically correct to say upper left quadrant. I don't really care which order you put it in, left upper or upper left. As long as you've got the directions correct and you know which one you're talking about, you're fine. But generally the left or right will come first. Down here we have the left lower quadrant. Okay? Over on this side, going clockwise, we have the right lower quadrant, and up here we have the right upper quadrant. What you should notice is that there's certain organs that are exclusively in one of the quadrants. For example, the gallbladder, which is shown here in green, is exclusively in the right upper quadrant. The appendix, which is this little thing that hangs down from the cecum of the ascending colon, this is exclusively in the right lower quadrant. Some things, like the urinary bladder, which is right here, are distributed evenly between the left and right lower quadrants. And then some things like the liver are mostly in one. The liver is mostly in the right upper quadrant, has a little bit in the left upper. Okay? But the major thing you need to be able to do for a quiz or an exam is if you have an arrow pointing at one of these quadrants, you need to be able to identify which one it is. So if you have an arrow pointed at this one, you would need to be able to identify it as the right upper quadrant. All right? Now these are pretty easy. The challenging part is when we use regions, because there's 9 of them. I like to think of this as tic-tac-toe. So first of all, let's actually look at this picture to get an understanding of what the regions are. We're going to start with the one in the middle. This is the umbilical region, right? It's one of the 9, and it's right where the belly button is. So right in the center of this is going to be the belly button, and so that's why it's called the umbilical region. Now, when you see the term gastric, a lot of times in medicine it's referring to the stomach, but just in general, gastric refers to all the digestive organs. Okay? Most of the digestive organs are concentrated in the umbilical region. If we actually look at this picture, what we see is that the intestines are kind of centered in the umbilical region right here in the center. Yeah, we've got the stomach up here, but most of the digestive organs are here in the umbilical region. If we look at some prefixes, epi means above. So if we look at epigastric, epigastric means above the concentration of the digestive organs. So it's above the umbilical region, so epigastric. Hypo means below. So this is going to be below the region where most of the digestive organs are concentrated. So hypogastric region. So right in the middle here we have epigastric, umbilical, and hypogastric. The other ones which are going to lie on each side of it are going to be the same, and they're going to have a left and a right each. Okay? So on the top we have the hypochondriac regions. Left over here, right over here. Hypochondriac in this context basically means below the ribs. Okay, so we've got these ribs right here. These regions are pretty much below the vast majority of all these ribs. Okay, there's some ribs in this area, but it's below most of the ribs. So hypo means below, so it's below the ribs. So over on this side we have the left hypochondriac region. Over here we have the right hypochondriac. Now below that we have the corresponding lumbar regions. Now, if we went around to the back side, that would actually be the lumbar region of the back. Okay, so over here we have the left lumbar region. Over on this side, we have the right lumbar region. Going beneath that, we have the iliac regions. Now, the iliac regions are named because the part of the pelvis that you can touch on your hips, the bony part, that's called the iliac crest. We'll learn that much later, but that's where the name comes from. It's the iliac region of the pelvis. So when you're walking carelessly and you bump the corner of your hip on the countertop and it hurts really bad, you bumped your iliac region. And so these two are named left and right iliac regions. All right? So hopefully that makes sense. What you need to really be able to do on a quiz or an exam is identify, again, what region we're pointing to. So if we pointed to this region right there where my mouse is, you would need to be able to identify that as the left iliac region. If we point up here, you'd need to be able to identify that as the epigastric region, and so on and so forth. So make sure you can do that for a quiz or an exam. So before we conclude, let's actually do a brief recap. So remember, we've got 4 major thoracic organs, and then we also have the thoracic diaphragm. We've got the heart, we've got the 2 lungs, left and right, the trachea, which is anterior and has rings around it, and then the esophagus, which is posterior to the trachea, not visible here. And then the thoracic diaphragm, or just diaphragm, separates the thoracic cavity from the abdominal pelvic cavity. Moving into the abdominal pelvic region, we have a lot of different organs here, but I want to focus on the ones that are a little bit more difficult. The spleen, remember over here, is on the far patient's left, and you might have to lift up the stomach a little bit to see that. Also the pancreas. It's yellow here in this model, but in a cadaver you may actually have to lift up the stomach to see the pancreas, which is mostly posterior to the stomach. Okay? The gallbladder, which we can actually see better in this picture right here, is going to be sort of between the stomach and the liver. The gallbladder is going to be green in most models, but in a cadaver it's going to be atrophied, it's not going to be green, and it's going to look more like a deflated balloon. All right? Make sure you can differentiate between the small intestine and the large intestine. And also understand that the kidneys are not generally visible with models like this. You'd have to remove everything out of them and understand that they are the most posterior of any of the organs in the abdominal pelvic cavity. All right? The urinary bladder is going to be in the pelvic cavity down here at the very bottom. All right? And then the greater omentum and mesentery are the more difficult ones. The greater omentum is going to lie on the anterior surface of all the intestines, but inferior to the stomach because it starts descending from the stomach. So all this is greater omentum. Whereas the mesentery, you actually have to look between the tubings of the small intestine and kind of pull them apart. So you'd have to look at this on the cadaver, and they kind of look like webbed feet between the abdominal pelvic organs, right? So hopefully that makes sense. Please make sure to like this video and subscribe to my channel for future videos and notifications. Thank you very much.